James Rachal, Associate Professor and Chair at Wake Forest University School of Medicine. I am also Medical Director for Behavioral Health Charlotte, part of Advocate Health. We have two leadership presentations. One is a learning lab focusing on skill building, and talking. My piece is primarily discussing um, uh, faculty, recruitment of faculty, development of faculty, retention of faculty. And then I have another presentation on intermittent partner violence. And it really looks at the causes, how some of the new gun laws have affected risks in intermittent partner violence. Also looks at special populations like military. And then there's a third um, third leadership seminar that I'm the chair of, and the discussions there look at first looking at the definition of leadership, and then leadership early in career and residency, how to develop leadership skills. And then it looks at once you're graduated, how to get involved in leadership, the utility of special degrees like MBAs, and then the final portion is looking at change management and involves a case as well, a case discussion. The the learning lab really focuses on how to develop, first of all, how to find good physicians and other providers, APPs, steps involved with that, steps then involved with making sure that when you do hire them, that they are successful, they're put in at least in a position to be successful, and then finally, how to work with them on career development, helping them improve their skills not only as a physician but also as a leader. The second talk looks at intermittent partner violence. Again, looking at risk factors involved with intermittent partner violence, how to identify those at higher risks. And also, we also utilize or discuss the utilization of standardized professional judgment tools. And then look at resources and interventions for victims of intermittent partner violence. Certainly some of the advances around TMS, ketamine, use of ketamine, also you looking at some of the use of the newer medications are all taking hopefully leaps forward on some of the interventions we can do. I know now we're moving into things like digital therapy, and other biometric tools that we didn't have in the past. Some of the challenges, I think, especially in behavioral health, we're always facing a funding crisis. There are always many patients. Unfortunately, the amount we actually get to reach is much smaller than the actual amount of